Telehealth is a simple, effective remote monitoring tool that can significantly improve the management of long-term conditions. It provides health professionals with a wealth of accurate vital signs data that previously would not have been available, while also empowering patients to self-manage.
One of our patients, Mrs. Ali, has been monitored with the telehealth machine.
Before telehealth, her blood sugar was very erratic and on the high side.
And we've seen a progressive improvement in her blood sugar since she's been on it. 61 times she attended either hospital or A&E, and since she's had the telehealth machine, I think it's down to 1 at the most.
The technology is aimed at the growing number of people with long-term conditions such as chronic obstructive pulmonary disease, chronic heart disease and diabetes. These conditions often mean reduced quality of life, inability to cope with day-to-day activities and dependence on health and social care support. The technique is empowering, reduces anxiety and encourages patients to live independently through effective self-care.
The people that we've had using telehealth haven't had any hospital admissions and have remained well.
Yes, since I've been using the machine, I haven't been in hospital at all.
Since being on telehealth, I haven't been into hospital.
The real-life example of Mrs. Hannaford shows how powerful this simple monitoring tool can be.
Mrs. Hannaford, we picked her up in May for an assessment for the telehealth. She's a lady who has had problems with her blood pressure, very high readings. She's not tolerant to hypertensive medication.
Are you okay then?
So we've been having to look at her blood pressures very closely. The readings we found in December were slightly raised, well, very raised. They were coming up in the red zone here.
On further investigation, it actually turned out that she had had a sudden deterioration of her condition, and we actually were able to diagnose it and treat it before it became a problem.
We wouldn't have visited her routinely at that point, and she hadn't asked us for a visit because she didn't feel unwell. So without the machine, we wouldn't have known about it. We treated her with some antihypertensives and her blood pressure came back down to the normal range.
So that saved actually going to hospital, because I think she would have ended up in hospital had we not had the right medication, which of course was due to the monitor.
What we were trying to prevent was to prevent her from having an event like a heart attack or a stroke from the high blood pressure. She continues to be well, so hopefully we have prevented such a thing from happening.
The benefits for me, of course, is time, and I couldn't go down to the surgery every 3 times to take blood pressure because doctors don't operate that way really. Having taken the measurements and I know they're all right, that gives me my peace of mind, and I can also relate it to my mother and it gives her peace of mind.
The technology itself is simple. A telehealth monitor installed in the patient's home enables them to regularly record their vital signs measurements, including blood pressure, pulse, blood oxygen, blood glucose, weight, temperature and peak flow. The information, along with answers to condition-related questions, is relayed automatically to a central point. From there, it can be securely accessed via the web by the patient's health or social care professionals.
This is where we receive the data. It comes out in a very simple traffic light system, so red, amber and green. If it's red, obviously it's something that needs to be looked at urgently. Amber means that could be a problem, and green means that everything's within the limits that we expect to see.
We set the individual variables for each patient and each measurement.
For clinical staff with heavy workloads, the system is a powerful time prioritization tool, and importantly means action can be taken before a patient deteriorates.
This telehealth scheme on the computer is very easy to look at, monitor. We have pages that we can go into. We can send messages down to the patients, like today, readings all okay.
Providing reassurance to well patients reduces inappropriate calls to clinicians and emergency services, enabling clinicians to focus their time more efficiently.
Another good thing about the telehealth system is that we're finding that the patients that are on the system are actually calling us to visit them at home less. They're calling the nurses less, and in fact they're also calling the GPs less, because they are able to feel that someone's already looking after them. If they feel slightly unwell, they've had their readings taken, someone's looking at it, they don't feel they need the reassurance of us visiting as well.
The system is not intended to replace clinicians' contact with their patients, rather it makes interventions more appropriate and more effective.
I see the doctor about once a month.
Telehealth data can support clinical decision-making and aid diagnosis, as well as significantly enhancing condition and medicine management.
We've managed to control people's blood pressures, we've managed to keep people out of hospital and to keep them healthy.
Kent County Council has invested in telehealth because of its huge potential for giving people the confidence to live independently and to self-manage.
It's giving patients their empowerment back into looking after their own health needs. Also the reassurance that the surgery is monitoring them closely, and especially the ones who can't get to the surgery or aren't out in outlying areas. They're self-managing.
If telehealth enables us to be more proactive in monitoring and identifying those conditions, if it enables people to be more independent and living in their own homes, then the project will have been worth it.
You're not alone, that's the point. You don't feel alone, there's somebody there.
It's like having your own sort of doctor here, isn't it?
Yeah.
Really.
I don't have to depend on people to come and see me and help me with things.
And that gives me more confidence. Very often I feel better for knowing it's there, that I can use it and not worry.